And Dr Chloe Furst.
Hi, hello, nice to sort of see you all. Yes, I'm a geriatrician and palliative care specialist in South Australia. I've been quite instrumental in the implementation of South Australians' voluntary assisted dying laws, and I'm a practicing practitioner with experience with over 150 patients.
Thank you very much.
Thank you very much, Chair. And I'd like to direct this question to Dr Furst, if that's okay. There has been some concern in this country about the efficacy of the end-of-life medication. So I thought I'd like you to just give me some of your experience in Australia about how effective they are and any problems you've encountered. Thank you.
Yeah, sure. The medications are completely effective. I have not had experience with any failures. It's one of the things that I feel quite comfortable reassuring my patients and their families is that this medication absolutely works. In terms of oral administration, which is the default option in South Australia, unless the patient themselves can't consume the medication or has problems with absorption, it puts them to sleep within a couple of minutes. They are heavily sedated like they are undergoing an anaesthetic, and then death ensues, i.e. the heart stops and respiration stops for about 95% of patients within about half an hour. There is a small percentage who will continue to be sedated for longer than that, but the heart won't cease, circulation won't cease for some hours after that. So we warn patients and their families, more importantly, that this may be the case, and that's sort of an enzymatic issue. But no, it's highly effective. Personally, I have not had any experience where patients have had complications, i.e. vomiting or respiratory distress or any other concerns, and certainly in South Australia that has not been an issue that's been reported to us. I think there's been a couple of cases of vomiting elsewhere, but it has worked in all cases as far as I'm aware around Australia as well. This has not been an issue. In terms of IV administration, again, that is highly effective, and by the time the medication has been administered completely, the patient is deceased. So this works, it's peaceful, and when patients say to me, I want to go to sleep and not wake up, this is absolutely what happens. It's a very peaceful death.
So just to confirm, Chair, is that right? Just to confirm, you haven't had any failures of treatment as far as you're aware?
No failures of treatment in South Australia as far as I'm aware, and I'm not aware of any sort of other particular ones around the country that have been really heavily broadcast to us.
Thank you.
Naz Shah.
Thank you, Chair. We've had lots of witnesses testifying about gaps in palliative care and end-of-life care provision here in the UK. What is the current state of palliative care and end-of-life care provision in Western Australia, please?
I'm in South Australia, but we know there was a recent survey done by Palliative Care Australia, actually, which surveyed over 900 palliative care specialists, and of patients receiving voluntary assisted dying, more than 80% of those patients are actually getting combined palliative care and voluntary assisted dying. We, in our legislation in South Australia, there's also key provisions that there would be monitoring of the funding to palliative care to ensure that no palliative care funding was diverted to voluntary assisted dying. But we feel very strongly that palliative care and voluntary assisted dying should go hand in hand, and really that is a feeling that is being seen around the country now. Palliative care physicians that are finishing off training now see voluntary assisted dying as part of their core business. It's no longer seen as something that should be provided by separate practitioners. So it's really becoming quite integrated. I think Meredith wanted to also comment as well.
On that point about palliative care, actually, if I can direct my question to Dr Furst, what's been the response from palliative care professionals to the introduction of assisted dying in Australia? We've heard evidence from people working in the sector in the UK, but I'm keen to hear what your experience has been in Australia, because I understand the Palliative Care Australia's National Workforce Survey explicitly looked at this, so I'd be keen to hear what their findings were.
Yeah, so I mean, I think it's been a journey, certainly. So Victoria started their voluntary assisted dying in 2019, and I would be lying if I said that the palliative care community were completely on board with it at that point. But over the last 5 to 6 years, there has been a real sort of shift in mentality, and I think we've seen that this can go hand in hand. Palliative care is about end-of-life choices. Voluntary assisted dying is about end-of-life choices. It's about putting the patient and the individual front and centre and working with them. And that is what's fundamental to palliative care. And I think as we've realised that voluntary assisted dying is just a promotion of palliative care, and it's giving them back choices. So, as I said, probably some of the older palliative care clinicians have not embraced voluntary assisted dying quite as much. That's probably very generalised, but certainly new consultants, new doctors that are coming through are really seeing this as something that they want to do. There's been no animosity, I don't think, anymore between the practitioners that choose to work in this space and those that don't. I get huge amounts of support from other palliative care physicians that don't necessarily act as practitioners, and there's no real divide. It's been embraced, really, to be honest, and I think in another 5 years there'll be probably very few palliative care practitioners that don't sort of support this unless they're true sort of conscientious objectors for their own, I guess, probably religious reasons. But yeah, Palliative Care Australia, the peak medical bodies within Australia, everyone has generally shifted to see this as part of patient choice.
Thank you.
Thank you very much.